the gaps today.
620 WDAE Tampa Bay Sports Radio. Who's banged up? Who's in the training room? It's time for the Dr. Locke Sports Injury Report. In pain, don't operate. Rejuvenate. DrLocks.com.
And right now we go to our favorite doctor. He joins us this time every week, Dr. Dennis Locks, with our injury report. Good morning, doctor. How are you?
I am doing very good. How are you all?
Doing well. It's good to talk to you. We're here with J.P. Peterson in for Tom Jones, and we're going to start with the Tampa Bay Rays, who have had their share of injuries this year. We've certainly talked about a lot of them, particularly with pitchers, and we've had Tommy John surgeries, and we've had all kinds of shoulder problems and this sort of thing. The latest one that's going to hurt them for a while, doctor, is a broken finger by their first baseman, James Loney. This seems to be more sort of towards the base of his hand or his finger. We've heard something like 4 weeks, but just in general, how will they monitor this? How long does it take a bone to heal, and will there be any residual effect from that when he does come back?
Well, it typically takes about 4 to 6 weeks to heal, and you've got to give it enough time for the calcium to be deposited around the fracture site so that it's stable, and that's why it's just going to take that period of time. It's not as easy to, you can't rehab it like you do other joints. It just has to have Mother Nature take that time to heal it, and placing any stress on it from catching the ball or batting will just start the whole process over again. So it's just going to take a long time. And you're right, with the depleted pitching staff, and it makes having one of their better infielders out much more difficult for them as a team.
Dr. Locks, JP here. I have a very important question for you. I know you're the PRP guy. Can PRP injections in the brain keep these guys from sliding head first? I'm kidding, of course. No, I was going to ask you about Desmond Jennings' knee. They tell us he has bursitis. First, I know my grandfather had bursitis. Why does an elite athlete have bursitis? And will PRP injections, could that help him get something going in the knee there?
Yes, it could. PRP is really pretty good for tendon problems and also for bursitis. Platelet-rich plasma, or PRP, is basically just concentrated blood that you concentrate the blood platelets. The platelets are responsible for clotting blood, but they also release growth factors, which help the healing process. So it sort of gives Mother Nature a boost to make an injured site heal faster. So it works as a potent anti-inflammatory, and actually the growth factors can create a healing effect on those tissues. So bursitis would respond to that quite well.
They might want to try it if they haven't, because I don't know why it's taking him so long to get back in the lineup. We're talking to Dr. Dennis Locks with our weekly injury report. And, Doctor, in New York, the Mets third baseman, David Wright, is one of their superstars, but he's now out because he has what they're calling lumbar spinal stenosis.
Yikes.
This sounds really bad, and in fact, he's sort of lost some of his power in terms of hitting a lot of home runs. Spinal stenosis, as I understand it, is sort of a narrowing of the spinal column?
Cord, yeah.
I mean, what kind of things can they do for him, and could this potentially affect his career going forward?
Well, lumbar spinal stenosis is just what you said. It's a narrowing of the spinal canal. It can happen in any part of the canal, whether it's the cervical, thoracic, or lumbar segment. It usually manifests itself by impinging or affecting the nerves or the spinal cord. And so once it gets to the point of being symptomatic and irritating your nerves, whether it's in the low back, it's typically your legs that get affected, you're not going to have the strength, and you're going to have a pain or nerve-type pain into your legs. If it's in your neck, then it can affect your arms. It's ended people's careers. I think Lenny Dykstra had it, and that ended his career. The problem with it is how you to fix it. Once they become neurologically compromised, you can really at that point have to surgically decompress the area that's being narrowed, and it's a tough surgery to come back from. They can, but it's hurt quite a few players in different fields.
Yeah.
Especially Peyton Manning had
a lot of football, yeah.
And his brother had it as well, and his brother never played because of that particular condition. He was a pretty good quarterback.
Cooper Manning, right? Yeah.
But that's what happened to Peyton Manning, is he had congenital narrowing of his cervical canal. So it can be congenital where you're just narrowed and injuries can make it worse, or it can be a development over time, typically in older individuals. But younger patients typically don't get spinal stenosis unless it's a combination of a disc that's herniated with a little bit of arthritis, and that can cause narrowing of the canal as well.
Hey, Dr. Locks, I'm hearing a lot of stuff about PRP. And I know it helps older guys. I know there's some guys out there that, may be balding, may have a bald spot or something like that. Does it help regrow hair? And what are some of the other things that it helps, just like some of us guys that are getting older?
Well, people are using it for hair growth. They're using it, or was a fad a couple of years ago, in what was called the vampire facelift, where they injected it into your face.
Heard about that, yeah.
With that. But PRP actually 20 years ago was the rage in veterinary medicine, but it's being kind of replaced now, and the thoroughbreds don't really get PRP anymore. They just get straight stem cells because it just works better. So it depends really on the type of injury that you're dealing with. Some things PRP works very well for as an anti-inflammatory, and some things like arthritis, the PRP just can't turn into a new cartilage cell, so you can't really get the same type of effect. So it depends on what condition you're using it to treat and what the right treatment is to determine what you're going to use.
Well, Dr. Dennis Locks knows all about PRP. Injury Report is brought to you by Dr. Locks' Sports and Regenerative Medicine. You want more information? Visit drlocks.com. In pain, don't operate. Rejuvenate. drlocks.com. Thanks, Doctor. We'll talk to you next week.
Appreciate it, Doc.
Thank you.
Have a great one.
The vampire facelift.
Yeah, that doesn't sound... You get the facelift, but then you immediately want to start sucking blood from people's necks. So I'm not sure that's a good idea. There was just real quickly, an interesting story or suggestion, actually what the Mets are doing. We're talking about the Mets. They're now, for the next month or so, going to go to a 6-man pitching rotation because guys like...
Harvey?
Matt Harvey, the guy coming off Tommy John, and some others, they want to protect their young pitchers. And we all know it's hard to find 5 starters, let alone 6. Yeah. But, JP, this sort of makes sense to me. And then when you're talking about, like, why they took Chris Archer out of the game after 95 pitches and you have a talent like that, then maybe you want to protect him, and maybe this is the way we should do it, because all these kids, as you know, are playing travel ball and AAU from the time they're 10 years old now, and the overuse on their arms has just been unbelievable. So that's why when they get to the majors, they're having all this problem.
Well, we need a whole revamping of the pitching protocol for youngsters. And, who's really to blame on a lot of this is, and I talked to Leo Mazzoni about this, Major League Scouts, if you don't throw 92, 93, you don't even get a look.
Yep. You got to hit the bar.
And so these guys they're not only throwing a lot, they're overthrowing.
They're throwing harder at an age when their bodies are not really able to do so.
These older guys used to throw, 80, 90% maybe. And when they were throwing, they never threw it 100%. These kids are throwing 100% every pitch. Can't do it.
Great point. And it's the biggest change in baseball in my generation has been the number of guys, not to just get hurt, but the number of guys that throw with that kind of velocity. It's routine to see a guy come out of the bullpen and throw mid-90s or upper 90s. It's unbelievable. Well, what has gone wrong with Brad Boxberger? We're going to ask Mark Topkin next.
From the Bright House Network's Traffic Center.
Accident along East Bay Drive between Belcher and US 19. Avoid that area if you can, because a couple lanes are blocked there. Also a crash along Big Bend near I-75. And slow traffic in all the usual spots. Southbound 275 between Fowler and Bush Boulevards, and southbound 75 approaching I-4. See traffic problems? Call the injury firm of Abraham Son and Utah Hillsborough Traffic Tip Line 866-545-9595.
This report is brought to you by Farmers Insurance. As if you didn't have enough to endure on the road, you may also be driving around with gaps in your insurance. At Farmers, they're out to help you close those coverage gaps so no one falls victim to them again. Talk to a Farmers agent and know the gaps today.
620 WDAE with all the play-by-play.
Touchdown, Tampa Bay!
The information you need on 970 WFLA. Breaking news, weather, and traffic.
Ron Diaz for my friends at Lowkey's pre-owned showcase at Lowkey Motor Company. When people trade in for a Mercedes-Benz or an Infiniti at Lowkey Motor Company, the best of the best trade-ins are kept and resold at Lowkey's pre-owned showcase. Here's a sample of their inventory right now at Lowkey. A 2011 black BMW 535M Sport Sedan. It's a rare six-speed with navigation and low miles. Check it out at Lowkey, a 2011 Cadillac SRX Luxury Collection SUV. Only 23,000 miles for only $24,991. Or a 2012 BMW 328 convertible with under 34,000 miles and full factory warranty. Lowkey's pre-owned showcase, located on US 19 in Clearwater. Take the Sam's Club Access Road off Gulf to Bay. Go see Rob and his staff at Lowkey's pre-owned showcase for these great deals, or go online to Lowkey Auto.